Did you know that prostate health is one of the most important things for men, but it is often neglected? The prostate is a gland the size of a walnut, but it plays a crucial role in the body. When it is not functioning properly, it can cause symptoms that directly affect daily life, such as pain, discomfort, and even difficulties with urination or ejaculation. In this video, we will talk about the signs that something might be wrong with your prostate, where you may feel pain, how to identify these problems, and most importantly, what to do to take care of your prostate health. Stay with me, because understanding these signs now can make all the difference in avoiding more serious problems in the future. Let's go. Function and anatomy of the prostate. The prostate is a gland located just below the bladder and surrounds the urethra, the channel through which urine exits the body. Imagine the urethra as a road and the prostate as a service station next to that road, helping to ensure everything works properly. It is the size of a walnut, but its function is essential. The prostate produces seminal fluid, which helps protect and transport sperm during ejaculation. In addition, the prostate not only contributes to the reproductive process, but also helps expel semen, something vital for male fertility. So if the prostate is not functioning correctly, it can affect both sexual and urinary health. That is why understanding where it is and what it does is the first step in identifying any problems early on. Where it hurts when there are prostate problems. When the prostate has a problem, the pain can appear in different areas of the body. The most common is pain in the pelvic region, which is located between the penis and the rectum. Some people even describe this pain as a feeling of pressure or discomfort in this area. But the pain doesn't stay just there. Sometimes it can spread to the lower back, causing a type of pain similar to back pain, because the inflamed prostate may press on the nerves and muscles in that area. Another important sign is pain when urinating or during ejaculation. This happens when the prostate is irritated or inflamed, affecting the urinary tract and genital organs. Depending on the severity of the problem, the pain may be constant or occur occasionally, so it's important to pay attention to these signs. So if you feel any pain or discomfort in these areas, it's always good to stay alert and seek medical help to investigate the cause. The earlier we identify the problem, the easier the treatment will be. Common causes of pain from prostate problems. Pain in the prostate can be caused by three main conditions, and it is important to know each one of them to understand the symptoms and the appropriate treatment. Prostatitis. Prostatitis is an inflammation of the prostate, which can be caused by a bacterial infection or other non-infectious problems. The most common symptoms are pain when urinating, burning, and even difficulty urinating. If you notice these signs, it's important to see a doctor, who may recommend antibiotics or other lifestyle changes to treat the problem. Benign prostatic hyperplasia, BPH. BPH occurs when the prostate grows in a non-cancerous way. This enlargement can press on the urethra, making it difficult for urine to pass, causing symptoms like weak flow, difficulty urinating, or the feeling that the bladder is not completely empty. Treatment may include medication or, in more severe cases, surgery. Prostate cancer. Prostate cancer is a more serious condition, where the cells in the prostate begin to grow abnormally. In the early stages, there may be no symptoms. However, as the cancer grows, it can cause pain and difficulty urinating. Treatment depends on the stage of cancer and may involve surgery, radiation therapy, or other treatments. Understanding these conditions and their symptoms is crucial so that you can seek medical help in time, ensuring the proper treatment and preventing more serious complications. Warning symptoms of prostate problems. Now, let's talk about the signs your body may be giving you when something is wrong with the prostate. These symptoms are not meant to scare you, but to help you identify problems from the start, when treatment is simpler and more effective. Difficulty or pain when urinating. If you notice that you are having trouble starting to urinate, or if you feel pain, burning, or a stinging sensation during the process, it may be a sign that something is wrong with your prostate. Frequent urge to urinate, especially at night. If you need to go to the bathroom many times during the night, or if you feel urgency to urinate even when the bladder is not full, this can also be a warning sign. Blood in the urine or semen. The presence of blood in the urine or semen is not normal and could be a sign of infection, inflammation, or something more serious. Therefore, never ignore this symptom. Feeling of incomplete bladder emptying. If you feel like the bladder is not completely empty even after urinating, this could indicate that the prostate is affecting the urinary flow. Discomfort or pain during ejaculation. Pain or discomfort during ejaculation may occur when the prostate is inflamed or has another issue. This symptom, along with others, requires medical attention. These symptoms do not necessarily mean something serious, but it is essential to see a doctor to undergo tests and ensure that everything is fine. Remember, the earlier you seek help, the faster the treatment will be. Diagnosis of prostate problems. When you start experiencing some of the symptoms we discussed, it's important to see a doctor to understand what is happening. The correct diagnosis is essential for effectively treating the problem. Let's look at how doctors make this diagnosis. Physical examination. The first step in understanding what is going on with the prostate is the physical examination, which usually includes the famous digital rectal exam. It may feel a little uncomfortable, but it is quick and allows the doctor to assess the size, shape, and consistency of the prostate, looking for signs of abnormalities. Blood test PSA. PSA is a protein produced by the prostate. The doctor will perform a blood test to measure the level of this protein. If the PSA level is high, it may indicate a problem with the prostate, such as an infection, inflammation, or even cancer. However, it's important to remember that a high PSA level doesn't necessarily mean cancer. Imaging tests. Tests like ultrasound or magnetic resonance imaging, MRI, are used to observe the prostate more closely. These tests help identify possible tumors, cysts, or other conditions that may be affecting the gland. Biopsy. In some cases, if cancer is suspected, the doctor may recommend a biopsy. In this procedure, a small piece of prostate tissue is taken for analysis in a laboratory. This helps confirm or rule out prostate cancer. These tests help discover what is causing the symptoms and decide what the best treatment is for each case. The good news is that the earlier the diagnosis, the easier it is to treat any prostate problem. Treatment to relieve pain from prostate problems. When you feel pain or discomfort caused by prostate problems, it's important to know that there are several ways to relieve these symptoms and treat the underlying cause. The treatment will depend on the condition affecting the prostate, and it can range from simple medications to more complex procedures. Medications. In many cases, treatment starts with medications. If the cause is inflammation or infection, the doctor may prescribe anti-inflammatory drugs and muscle relaxants to reduce swelling and relieve pain. These medications help control inflammation and pain, providing relief from symptoms. Surgical procedures. When prostate problems are more severe, treatment may require surgery. Two of the most common options are RTUP, transurethral resection of the prostate, a surgery that removes part of the prostate that is causing obstruction in the urinary flow. Prostatectomy, a more radical surgery where part or all of the prostate is removed, usually recommended in cases of cancer. Complementary therapies. In addition to traditional medical treatments, there are complementary therapies that can help relieve symptoms. Some options include phytotherapy, the use of herbs and medicinal plants to assist in treatment. Acupuncture, a technique that uses fine needles to relieve pain and promote well-being. Pelvic floor physiotherapy can help improve urinary control and relieve pelvic pain. It's always important to work closely with your doctor to find the most appropriate treatment for your case. Every person is different, and a personalized treatment plan is the best way to achieve relief and improve quality of life. Myths and realities about prostate problems. Many people have misconceptions about the prostate. Let's debunk some important myths. Myth number 1, pain in the prostate always means cancer. Not all prostate pain is a sign of cancer. There are other conditions, such as infections and inflammation, that can also cause discomfort. Myth number 2, prostate problems only affect older men. Although prostate problems are more common with age, younger men can also experience prostate issues. Paying attention to symptoms is important at any age. Reality: prostate care is essential at all ages. Maintaining prostate health with regular exams and medical care is essential for all men. Now that you know more about how to take care of your prostate health, make sure to return to the channel for more tips and important information about your well-being. Subscribe to the channel, turn on the notification bell, and share this video with your friends. Health is our greatest wealth, and together we can ensure that everyone has the right information to take care of themselves in the best way possible. Until the next video, and don't forget to take care of yourself.